Hi, I'm Rupal Mehta. I'm 36 years old. I live in Hyderabad, Kondapur. So, I had been to Apollo Kondapur for a regular body checkup, and in the x ray, they saw a patch in my right lung. So, the USG doctor was very prompt to notice that there is a patch in the x ray and asked me to consult a pulmonologist immediately. So in Apollo Kondapur, I consulted Dr. Radhika, and she really helped me to get through the tests and keep me calm without making me tensed about what the problem can be. Then I went through the CT scan and different tests, and seeing the problem, Dr. Radhika suggested that I meet her senior at Apollo Jubilee Hills, Dr. Srikar. Seeing Dr. Srikar only, like, I felt very relaxed because he was very calm and he explained everything very well. He didn't like ask me to go for too many tests further, and he suggested that I get hospitalized only when it is required. Like, I was ready to be there for more time, but he said no, it's better you just be there for how much it is required. I went through a bronchoscopy process with him, and in that they detected that there was a tumor which needs to be removed surgically. So obviously, listening about surgeries, everyone was a little tensed, but Dr. Srikar ensured that he referenced the person who is really experienced, especially in lung surgery, Dr. Shashikiran, and Dr. Shashikiran explained the entire process very well. All doctors were very approachable. All my queries, whether be it on WhatsApp or on calls, were answered immediately, and it really helped me to take action fast. I was tensed, but the entire process went very well, and I can say, like, it was like I felt magical hands did the work. Today, my tube from the lung was removed. Throughout the surgery and other processes, I was under anesthesia. But today, I was not given anesthesia, so actually, I felt the fear because I had to be experiencing that. But I didn't feel the slightest of pain, and the entire process was very well done. I thank all the doctors, Dr. Shashikiran, Dr. Srikar, and Dr. Radhika for helping me through this journey and making this so smooth and easy. I would specially like to thank Dr. Shashikiran. He explained the entire surgery process really well. Listening to the fact that a part of my lung will be removed had really made me tensed, but he answered all the queries. He made it very clear that it will not be any trouble after the surgery, and he answered multiple questions multiple times, even if I repeatedly asked him. He was very supportive. Even after the surgery, he ensured that if I am feeling any pain or anything, he can address it very soon. And removing the tube also, he ensured that I don't feel too much pain during the stitches. I really did not realize when he took the stitches and when the tube was out. I think most of the pain was reduced because of how fine and how smoothly he did the process. And all the nurses and staff around were also very supportive and very prompt in taking action whenever I called them. Thank you.
Hi, I am Dr. Shashikiran. Today I am going to discuss regarding one of my patients which I operated recently. She is Mrs. Rupal Mehta. She is a 36-year-old female who presented with history of cough since only last 10 days. On evaluation with CT scan, we found her to have a lesion in the right lower lobe, and the CT scan features were suggestive of a bronchial carcinoid. Bronchial carcinoids are very rare tumors. They usually comprise around 1 to 3% of lung tumors. They are generally benign. They can present with symptoms related to hormone secretion by these tumors, they can be presenting with asthma-like features or excessive facial flushing, but these symptoms are very rare. Generally, they present with either cough, or it can be hemopsis, or that is blood in the cough, or they can be incidental detect on CT scan done for something else. So we evaluated her with bronchoscopy, and then we went ahead with uh, surgery. We did a single port or uniportal VATS with only around 3 centimeter incision, and we removed the right lower lobe. She had an uneventful post-operative stay, and we could discharge her by third day, and with minimal pain. So in these patients, especially any kind of lung tumor or bronchial carcinoid, minimally invasive method is quite feasible, and it leads to very early recovery, and they can have a normal life maybe within 1 week to 10 days only. Thank you.